All right, today we're going to tackle a topic that affects literally millions of people, but let's be honest, is often just whispered about. We're talking about urogenital infections. We're going to take a tour of the body's inner plumbing to really understand what's going on, why it happens, and what we can do to stay healthy. So let's get right into it.
So let's start with a number. Just look at this. 50 to 80%. Let that sink in for a second. That is the staggering percentage of women who will get a urinary tract infection, a UTI, at some point in their lifetime. So yeah, this is not some rare thing. It's an incredibly common health issue that really deserves a closer look.
So that brings us to the big questions, right? What exactly are these infections? How do they even happen in the first place? And probably the most important question of all, what can we do about them? We're going to answer all three. Okay, so first up, let's talk about who this actually affects. Now, we tend to think of UTIs as a women's health issue, and they often are, but the real story is, well, it's a lot more complicated than that. The risk actually changes dramatically for both men and women throughout their lives. And this is where it gets really interesting, because the risk profile just completely flips. In infancy, believe it or not, boys actually have a slightly higher rate. Then, for the next, 4 or 5 decades, it becomes overwhelmingly a female issue. But then, after age 50, the rates in men start to creep up, often because of an enlarged prostate, until they're almost neck and neck with women. To really get a handle on any problem, you first have to understand the battleground. So let's take a quick tour of our inner plumbing, the urinary and genital systems, to see what we're working with.
Okay, so check this out. On the left, you've got the urinary system. It's this amazing filtration and drainage network. The kidneys produce urine, it's stored in the bladder, and then it leaves through the urethra. Simple enough. But now, look at the reproductive system on the right. See how close everything is? They're practically next-door neighbors. And that close proximity is a huge reason why these infections happen.
So, we've mapped the territory. Now, it's time to meet the invaders. And the real question is, how does a bacterium that's supposed to be harmless in one place, like your gut, cause so much chaos somewhere else? Well, the number one culprit, by a long shot, is a name you probably recognize: E. coli. It's behind up to 90% of all UTIs. It's totally normal in our gut, but when it travels to the urinary tract, it becomes a huge problem. Sure, there are other bacteria that can cause trouble, but E. coli is the undisputed king.
Now, this is absolutely crucial to understand. Getting an infection isn't as simple as just being exposed to a germ. It's really more like a three-way dance between the bacteria, the host, that's you and your body's defenses, and the environment. Whether you get sick or not all comes down to how that delicate balance plays out.
So, what can tip that balance? Well, it can be behavioral things like sexual activity, which can introduce bacteria to the wrong place. It can be your own medical history. If you've had a UTI before, you're more susceptible. And it can be physical things, like using certain types of birth control or medical devices like catheters that just create the perfect environment for bacteria to set up shop. So what happens when that balance tips and an infection actually takes hold? Well, our body is pretty good at sending out some clear warning signals. Let's learn how to read those signals and see how doctors confirm what's going on. Figuring this out is actually a pretty straightforward 3-step process. It all starts with you listening to your body and recognizing the symptoms. Then a quick screening test, the dipstick, gives us the first big clues. And finally, a look under the microscope gives us the definitive proof. So, step 1, what are you actually feeling? Well, for a simple bladder infection, which is called cystitis, the classic signs are unmistakable. We're talking about a burning pain when you pee, feeling like you have to go all the time, and a sudden intense urgency that you just can't ignore. These are your body's alarm bells, and they are ringing loud and clear. Next up is step 2, the dipstick test. And this little strip of paper, it's actually kind of a genius piece of tech. It's looking for 2 main clues. The first is an enzyme from your white blood cells, your body's little soldiers, which tells us a fight is going on. The second is something called nitrites, which is a chemical byproduct that bacteria like E. coli leave behind. If either of those pop up, it's a really strong sign you've got a UTI. And then, for the final, undeniable proof, we go to the microscope. Seeing the actual bacteria swimming around and the white blood cells that are there to fight them, well, there's no arguing with that. This is the visual confirmation, the smoking gun that tells us exactly what we're dealing with. All right, so we've identified the problem, we know how to spot it. Now for the part you've been waiting for. How do we fight it? And, just as importantly, how do we keep it from coming back?
Now, this is a really, really important distinction to make. Not all UTIs are the same. A simple bladder infection, or cystitis, is usually handled with a short course of antibiotics. But if that infection travels up into the kidneys, it becomes what we call a complicated UTI, or pyelonephritis. And that is a whole different ballgame, much more serious with high fevers, intense pain. It requires much more aggressive treatment. Catching it early is absolutely critical.
But you know what's better than fighting an infection? Not getting one in the first place, right? Prevention is everything, and it often boils down to some pretty simple habits. Things like flushing your system by drinking plenty of water, making sure to empty your bladder regularly, and practicing good hygiene. These are small changes that can make a massive difference.
Hey, remember how we talked about everything being so close together down there, that anatomical proximity? Well, that's exactly why we need to look beyond just the bladder to get the full picture. So let's quickly touch on a couple of other common infections in the neighborhood.
For women, another very common issue is vaginitis. And when people hear that, a lot of minds jump straight to yeast infection. But take a look at this. Yeast infections only account for about a quarter of cases. The most common cause is actually something called bacterial vaginosis, which isn't about an outside invader at all, but an imbalance of the normal, healthy bacteria that are supposed to be there. And for men, there's another key player in this neighborhood: prostatitis. If you look at the diagram, you can see the prostate gland sits right at the base of the bladder, like a gatekeeper. Because of that critical spot, when it gets infected, it can cause a whole host of problems, both urinary and body-wide.
And listen, this is not like a simple bladder infection. Acute prostatitis can make a man feel seriously ill. We're talking high fevers, chills, significant pain, on top of all the usual urinary symptoms. It's a serious condition that needs immediate medical attention, for sure.
So, when you boil it all down, what's the big takeaway here? It's simple. Understanding how your body works is a superpower. It gives you the power to recognize the signals when something's off and to get the help you need. Knowledge really is the first step to staying healthy. Thanks for joining us, and let us know what we should demystify next.